Good morning, Doc.
Good morning, Dziffa.
How are you?
I'm very well.
I love your socks.
Thank you very much.
Now, infertility in women, what is it and why is it so important for us to have this conversation?
Well, it's in English, infertility simply means they are not fertile, they cannot produce children. But by definition, we are talking about an inability of a couple to conceive after a year of regular sexual intercourse. Now, there must be regular sexual intercourse. We are talking about at least 3 times a week.
Wow.
This is very, very important.
Okay.
You'd be surprised that there are so many couples not having regular intercourse and then they are expecting to have a baby.
So the minimum for regular is 3?
It's 3.
Wow.
Anything less than 3 a week
is regular.
No.
We're busy people.
That's woefully inadequate.
Wow. Okay.
That's
Couples
woefully...
out there, you have a way to start the conversation.
But even with that, also the age of the woman becomes a major factor.
How?
So this 1 year window we are talking about is for women who are below 35 years.
Wow.
Yes. Now, as you grow older, we narrow the time frame. So, for instance, if you are between 35 and 40, we say 6 months. If you haven't been able to conceive within 6 months of having regular sexual intercourse, you are considered infertile and need to be treated or need to be attended to.
Why 6 months versus 1 year, depending
Well,
on
because
your age?
as you grow older, for a woman, the quality of your eggs, for lack of ovules, as we call it, diminishes. So the chance of getting pregnant actually reduces as you grow older. So less than 35 is considered your prime. So we have the luxury of time. So 1 year of regular sexual intercourse. If there's no pregnancy, we'll say you are infertile. If you are above 35 to 40, 6 months. If you're above 40, then you should actually start. You should probably get tested even before you try to get pregnant. Yes, because then your chances are even smaller, even narrower.
What do we get tested? What are we getting tested for?
Well, so we want to make sure that everything is fine, number one. And if there's an issue, we want to pick it up early so that we can actually start dealing with it now before you even have the try to get pregnant. We don't even want you to wait until you want to get pregnant before you come and get screened. We want you to screen now. So once you realize, okay, I want to have a baby, I'm 40 years, you should go and see a doctor.
Okay.
So that we'll start a screening process, take you through whatever needs to be, taken through, and then find out is there a problem, is there an issue that needs to be addressed, so that as soon as she thinks I want to get pregnant now, everything should be right medically so that she can actually get pregnant.
Okay. What causes infertility?
Interesting. So now, conception it requires 2 people, a male and a female. Unfortunately, culturally, the women get blamed for most of the infertility issues. But interestingly, about 30% of the issues are the male.
Wow.
Then 30% are female. 30% is the couple, and 10% we don't know.
So 30% could be the woman, 30% could be the man, 30% could be both of you together.
Exactly.
And maybe 10% we don't know.
So maybe. If the woman had this particular problem by herself, she could still get pregnant. But because she has this problem and the man also has this problem, the 2 of them now become an issue. Okay. So that's when we say that is the couple, the 30% is from the couple. That's what we mean. The same
woman can be with a different man
and get pregnant. Yes. But because she's with this particular man, and this particular man also has this small problem, then the 2 small problems become a major issue. So 30% is due to the female, 30% to the male, 30% to the couple, and 10% we don't know. We just don't know.
Wow. So let's start with the 30% for the female.
So for you to get pregnant, number one, we need to make sure that you have the ability to actually carry a pregnancy. Okay. So you must have a womb, you must have a functional fallopian tube, you must have functional ovaries, your hormones must be working properly, you must be having your regular, ovulation, so all those things must be intact for you to even consider having a pregnancy. So if you had an accident in the past and your womb has been taken out, obviously you can't get pregnant, through the natural means. If you probably have a hormonal imbalance, if it's not corrected, you can't get pregnant because it could affect your ovulation and the condition of your womb, so you can't get pregnant. So that's number one. Number one is that the woman must have the ability to actually get pregnant and carry a baby. Okay. Number 2, you must obviously have a partner in the traditional sense of the word. You must have a male to contribute the sperm for her to get pregnant, and that male sperm must be good. If the quality of your partner's sperm is not good, obviously you cannot conceive a pregnancy.
What do you mean by a good sperm?
So there are characteristics that a sperm must have. First of all, the sperm is able to travel straight in a straight line.
Like just straight.
Purposeful swimming.
Okay.
It must be able to locate the egg and then fertilize that egg. So if the sperm is going around in circles, it cannot go and it cannot fertilize any egg. Wow. Because the egg, you see, the egg stays in the fallopian tube and waits for the sperm to come. So the sperm must be able to move and locate the egg. Otherwise, fertilization cannot occur. So if the sperms are not enough, they might all die even before they reach the egg. So that's number one. Then if they are not able to travel straight, again, they cannot reach the egg. If the sperm is deformed, it has two heads, two tails, it's not good. It's not good sperm, so it cannot fertilize the egg. So that's very, very important.
So you have to get your partner's sperm checked as well? Or?
Well, not routinely, but assuming you've been trying to conceive and it's not working, definitely your partner is part of the issue. We need to check him as well and make sure that everything is fine with him. Then, of course, we'll check the lady as well, make sure everything is fine with her. And then, depending on whatever the results show, then we need to put the results together and then attempt to find a solution. So that's number two. Your partner must be able to provide good sperm. Then number three is that when the baby is actually formed, you should be able to now carry the baby to term. Okay. So again, we have women who are unable to keep pregnancies, because probably, and this might be controversial, they may have a fibroid.
But now, you've also been advised to, be pregnant before you take it out or something like that.
No, so the thing about fibroids, and that's why I said it's controversial. The thing about fibroids is that fibroids by themselves do not affect fertility. However, by their location, they may impact, the survivability of a pregnancy. So if you have a fibroid that is submucosal, it's right inside it's in the lining of the womb where the baby is supposed to implant. So if the fibroid is there, obviously the baby cannot implant on that spot. So if the fibroid is located in the place where the baby must implant, then there's a problem. So that's what I mean by if there's a fibroid, then the baby might not be able to implant. If you have a uterine deformity, when I say a deformity of the womb, it could also affect your ability to implant. So over there, we are seeing that there's a fibroid that's part of the cause of infertility. So that's what I was describing. So if you have,
so where the fibroid is now is where the fetus is supposed to be.
So that's the submucous layer. The area, the space, the white space is where the baby is supposed to implant. And so anything that affects that lining could prevent the baby from implanting. Wow. And if that fibroid tends to be big, even if the baby does implant, it could prevent the baby from growing normally.
Because it's sharing the space.
So usually, even though fibroids are not a significant cause of infertility, if a woman is trying to get pregnant and she happens to have a fibroid in that space, that fibroid would tend to be removed.
Wow.
To enhance the chance of that woman achieving successful pregnancy to term. So I was mentioning that if you also have a womb abnormality, some people have we call it septate uterus. There are several abnormalities. It could affect your ability to keep a pregnancy. If your cervix is incompetent, when we say cervix incompetent, the cervix is the mouth of the womb. It's supposed to stay shut until the baby is fully grown, then it's open and then you push the baby out. But if the cervix is not able to do that, it opens too early, you tend to lose your pregnancy. So all these are factors that we would check when a woman comes in with an issue of infertility. But the definition is really, really important because sometimes, because some women especially, they tend to be, because culture puts pressure on the women to get pregnant early. The woman gets married and within 3 months they are in your office, I'm not getting pregnant. And it puts a lot of pressure on them. And stress actually inhibits or prevents pregnancy.
How? What's the connection?
Because the body is like a computer. Stress is, when a lion enters the room, your stress hormones go up, adrenaline, noradrenaline, because they want you to escape.
Yeah, fight or flight.
Nobody thinks about having sex when there's a lion in the room. And so once your stress levels go up, your stress hormones also go up. And so it prevents your sex hormones and your fertility hormones from working.
So even if you're actively participating, all those hormones are not fully there because you're stressed out.
Exactly. So that's that's why it's important to understand that the definition, the time is important. So if it's not up to 1 year, don't stress yourself. Because by putting an unnecessary burden on yourself, you end up getting your stress hormones so up, your blood pressure starts going up, your blood sugar is deranged. All these things will prevent you from actually getting pregnant. So it becomes a vicious cycle.
But how do we calm ourselves down when we desperately want a baby? Because your mother-in-law is asking
Yes.
for the baby, how do you trick your mind to say, let me relax, it's going to happen?
Well, I think,
especially when you have a goal in mind.
I think that's part of the reason why this education is important. But of course, if you also go to a hospital and they find the history that you've only been married 3 months, or you've only been having active sexual intercourse for only 3 months, nobody is going to do anything about that.
It's not an emergency.
It's not an emergency. So they will calm you down. They will tell you that it's normal. Take your time. And I don't know if you know this, but in Ghana, I don't know, especially in Accra, a lot of married couples don't live together. And that's also a major issue. See, because the woman's menstrual cycle, women are only fertile for about 3 days in their whole menstrual cycle. Yeah. So, and if you, the man or the woman, don't know their cycle, you don't know when you are fertile, you could be having sex, but you probably be missing all the key times because you're not living together.
When should we have sex if we want a baby?
Well, to answer that question, the woman needs to know her cycle.
Okay.
Because when you know your menstrual cycle, and when I say menstrual cycle, it starts from the first day of your period. Okay. That's day 1. To the end of that. So
let's say I started on the 12th.
So that's day 1 of your new menstrual cycle.
And then it will end on the 20th. Or the 19th.
When
can be 8 days, like maybe 6 days, 18th.
Remember that your menstrual cycle is not the same as the number of days you have your period for.
Ah, okay. So when would it end, since you're the doctor?
So
this is a hypothetical situation, okay? I'm being a patient here.
So you may have had your period for 2 days, 3 days, 5 days.
Like physically seeing the blood.
Yes, that's when you're having your period. But your menstrual cycle starts from the day that you saw the blood first. So that's day 1 of your new menstrual cycle.
The one doesn't end.
And it goes all the way to then your next bleed.
So it's like the whole month.
Exactly.
So when do you have the sex?
So
to
now,
conceive the baby.
So now, if your menstrual, so you need to do this calculation, this monitoring for about 6 months. Then you strike an average. So if you are getting say 28 days or 30 days, so your average is 30 days. Now the second half of your menstrual cycle is the part that is kind of fixed, which is about 14 days. The first part is not too fixed. So now you have to calculate sort of backwards. So if assuming my that was the when now you know that you know your cycle is 30 days. Yes. So you count back from the 14 days from the 12 backwards. So let's use 14 to be on the safe side.
Okay, because our math might not
exactly.
be.
So you had your period on the 14. So count back 14 days. That takes you to the first, right?
First, yeah.
So that means that on the first, give or take one day, is when you're ovulating. You get what I'm saying?
The first of the next month.
The first of the previous. So exactly. So then now you count after you now know when you're ovulating.
So the first of the previous month is when you were.
So then now you project that one forward.
Okay.
So that you now have an idea when you're ovulating. So if you really want to have sex and achieve pregnancy, you should be having that sex around your ovulation period. But let's not get too technical.
Okay.
As a woman, almost everyone knows that there's a period in the month that you actually get extra. It's too early in the morning.
Excited.
Extra excited. You actually want to have sex. When that happens, you know that you're ovulating, because at that point there's an increase in testosterone in the woman. Okay. Yes, I know testosterone is a male hormone, but yes, testosterone also is the sex drive hormone. Okay. So at the point where you are ovulating, nature or God has made it such that your desire for sex will also go up. So naturally,
we got a message here from a viewer, Evelyn. She said that she usually feels very excited just before her period or right after her period, but she doesn't really know the cycle that the ovulation.
So it's not just before her period. I'm sure it's a couple of days before the period.
Yeah.
So if you're actually observant, you notice that there's actually a point about 2 days in the month that you actually feel that I must have sex. Even if the guy you have a crush on passes by, you suddenly feel like, no, this is it, I must do it.
So that's when you need to find your partner.
Exactly.
Okay.
But now the challenge is because most couples don't live together, they miss that window.
So then, the minute you start, then you have to tell your parents, I gotta go, because I need to find my partner.
Exactly. Okay. You see. So that's the thing. But then, if you are now having sex every other day, because if you are doing 3 times a week, that's every other day. If you're actually having sex every other day, you most likely find that window in your sex encounters. Okay. So that's why we say that you must necessarily be having sex at least 3 times a week if your aim is to have conception. Ooh. So if you come to me and you're not even having enough sex, Why are you even worried? Because you haven't even fulfilled the first requirements. Exactly. You're not even doing the barest minimum. You see, so so you need to try and relax.
Have sex
and just enjoy the sex, so that eventually you have that pregnancy you're looking for. Because once you are worked up or wired up, your stress hormones go up, and it's going to prevent you from actually achieving the goal.
What are some signs of infertility?
So, well, let's talk about the causes of it, because as signs of infertility, we don't really have some, because, you can't get pregnant, that's all.
Okay. But maybe, I don't know, maybe you're not getting your period regularly or something.
Well,
that's the cause.
You see, but again, that's also dangerous, because this may take us to another dimension, but not every woman actually sees blood.
Even though they are going through their period.
Exactly. It gets tricky. Personally, I've actually dealt with a couple of, not too many, but a couple of women who have actually supposedly never menstruated per their own standards. But after you speak to them, you realize that, okay, they had an episode of spotting every so often. They don't consider it as period.
But
you see. But for us, the volume of blood doesn't really matter.
Okay.
You understand? So let's not say it's not so much about whether you're having a period or not. The truest test of fertility is the ability to conceive.
But are there things that you may be able to see that you're like, this might, especially when you're early 20s, because we take a lot of things for granted in our 20s, and then in our 30s we really want to have a baby.
Exactly.
Then it might be late.
So one of the key things, one of the major causes of infertility is recurrent pelvic inflammatory disease, so PIDs.
Okay.
So occasionally you may have a pain in your lower abdomen. You may ignore it. You may have a vaginal discharge. Ignore it. It doesn't get treated properly. You may have even caught an STI which you ignored. You didn't treat properly. All these things can cause blockage of your fallopian tubes. And if the fallopian tube is blocked, that means the egg cannot enter. And if the egg is not able to enter the fallopian tube, that means that the egg doesn't get to where it needs to be fertilized. And so it doesn't matter what is happening, you're not going to get that fertilization because the tube is blocked. And if it so happens that both tubes are blocked, then there's no chance you can get pregnant naturally. If one tube is blocked, you might get pregnant, but if they both are blocked, the chance is very, very, very minimal. And obviously if you also have, so that's one. Two, if you had an operation before, probably had an ectopic pregnancy, and this is something that a lot of people don't know, but when you have an ectopic pregnancy and especially if it ruptures and you require surgery, the surgery removes the fallopian tube. Because this rupture, you cannot do much with it. So if you've had more than one ectopic pregnancy, then obviously means that you don't have any fallopian tube, so you can't get pregnant naturally. Because of advancing technology, there are several ways of achieving pregnancy. So that's why I'm stressing on naturally. So anything that affects your tubes will prevent you from getting pregnant. This is very, very. So that's the whole thing. So recurrent pelvic inflammatory diseases, ectopic pregnancy can prevent you from getting pregnant subsequently. So all of those are very, very, very important. Of course, there are some genetic aspects as well that could prevent you from getting pregnant, but I don't want us to get into that because we can't do much about it. Obesity and diabetes. Well, in fact, obesity, diabetes, hypertension, these three tend to go together, and they can affect your chance of getting pregnant or maintaining a pregnancy. Because obesity actually increases your male hormone levels, because the fat cells tend to androgenize some of the other hormones. And so that's why one advice the doctors will give you if you're having an infertility challenge will be to lose weight. That's if you're overweight. So very important to maintain a healthy weight. Check your blood pressure as well, because blood pressure can affect your chance of getting pregnant. Your sugar, diabetes, can also affect your chance of getting pregnant. And diabetes has a double impact, because when your blood sugar is high, you also tend to have recurrent infections. And we've already stated that a recurrent infection can also cause you to not have, to cause your tubes to be blocked. So diabetes sort of gives you a double impact. So these are some of the things that we need to avoid. And in our tradition, and it looks like every time I come here, some way we end up talking about it. Douching. Yes. It can also cause you to have some of these things.
How?
Because you introduce certain foreign elements into your vagina. And again, every time I mention vagina, I need to clarify. The vagina is the tube, the inside, not the outside.
Vulva.
And so you introduce foreign material inside, and this foreign material can travel up into the womb and then into the fallopian tube and then cause you problems. So it's important that as much as possible, don't interfere with the processes that go on in that space.
We need to end on a positive note. So if we find out that we are infertile, how do we handle it without being so hard on ourselves?
So if indeed you have gone, by definition, you now fit into the category that you are infertile, you are unable to achieve pregnancy normally or naturally. There are so many ways now. There's been so much advancement in that area. There are so many ways we can actually help you do that. I mean, there are artificial insemination techniques. There are in vitro fertilization techniques. There so many. There's so much expertise in that area, even in Ghana at the moment. So many people are experts in doing these things, and we can actually help you.
Okay.
You see, so it's important that you report to the right place early. Oftentimes, people go through all sorts of other channels.
Individual stuff. Is it bad for us? Because a lot of women just use that as last resort. Start drinking all sorts of bad things, just hoping to conceive.
A lot of the BBG on the market is not registered and not regulated. A lot of them have toxic elements in there. So in your quest to achieve pregnancy, you might end up shutting down your liver.
Okay.
And so it's important that you go to the right source, get the right information, and then achieve the results you're looking for. And it's very possible to actually achieve the results you're looking for in Ghana. You don't even have to go far in Ghana.
And there's no shame in
at all. There's no shame.
Have a baby in a different way.
Definitely.
Thank you so much, Dr. Kelvin, for being with us. We have some messages here. Ebenezer, watching us on Facebook, says, interesting. Felix Venio says, very interesting indeed. It looks like the men are really interested in this. Mami Sika Bordi says, very rich information this morning on infertility in women. This morning, you nailed it as always, Dr. Kelvin Owusu.
Thank you.
Mary from Nungwa says, thank you for this insightful information, Doc. So it looks like a lot of people are really enjoying this. I'm Nati. Doctor, you are really making my day. Good work done, Citi TV, watching you live in Damongo, Savannah region. Thank you guys so much for watching. We have to talk about infertility in men next week so that we know how to handle it. But how important is empathy when we finally have the conversation with our partners? And should we do it with our doctors so that they understand why we're going through what we're experiencing?
I think, first of all, once you understand, and I'm speaking from a male perspective, once you understand that the man is as equally to blame for infertility as the woman is, it takes a lot of pressure off the women, because from the get-go, the woman feels like they have to bear the child. And so once they hear the diagnosis of infertility, there's already an element of depression and apprehension, and why am I abnormal? Why is it happening to me? So the men really need to take responsibility as well, because it could just be you, because it's 30% male, 30% female, So both of us are to be blamed. So let's stick together. I mean, protect the women, because in these instances, the whole family will be against the woman. So you, the man, have to stand by the woman and fight through this thing. Because, as I said, there's no shame in it, and it's mostly treatable. So let's just get the information from the right source and take it from there.
Thanks, Doc.
Thank you very much.
More men like you. Where do we follow you on social media?
Well, you can find me at Kelvin Owusu MD on Instagram and Facebook.
and Twitter.
Yes, Nasepuku or Kelvin OW.
Thank you so much, Doc, for being with us. Hi there. We hope you enjoyed the show.
Make sure to subscribe, like, comment, and share with your friends.
This is Breakfast Daily on Citi TV.
Join the Breakfast Daily team Monday through Fridays from 7:30 a.m. to 10. Join us for breakfast daily, only on Citi TV.